So I want to introduce Bryce Ward and let him get right into his presentation. Bryce is a local economist specializing in the Missoula economy and healthcare economics. And Bryce has been instrumental since the very beginning. He was the first presenter of this task force conversation that we started now 35 days later. Seeing that number, I must admit, it was a little shocking. As we noted prior to the call, it feels like an eternity ago and just like several days ago. So I want to give Bryce the opportunity to share what he knows from his expertise on what's been happening and where we are headed. So he does have a PowerPoint that will be on his screen. Again, we are recording this call, so to be able to share later if you need to see the slides, but I'm confident that just hearing what he has to say will be sufficient for those who cannot see the slides. As Holly mentioned, we do have options for Q&A afterwards and want to hear from you and get your feedback. So feel free to, you can raise your hand afterwards, or if you have questions, please put them in the chat and we will address those when that opportunity arises. So I'll turn it over to you, Bryce.
All right, thanks, Julie. So it's been 35 days since I last spoke to you. We're 1 week too late for me being able to reference an actual virus apocalypse movie, but I stuck with the 35 days later as at least an homage. And it's been obviously a very strange period. In some sense, I feel like I am years older, and in some sense, it feels like, did I just talk to these people like a week ago? So things are weird. There is some good news. The good news is that Montana has done a pretty good job of not suffering from a major outbreak. So we have, this is deaths per capita on a log scale, so it's a little bit weird, but we're way down at the bottom, and that's good. And if you look at our, effective reproduction number, this is the thing that we need to be below 1 for us to see the epidemic go down. We've been below 1 for almost 2 weeks now. And so that's also very good. And it's kind of naturally leading to, some just, more individual relaxing of social distancing rules, at least what I'm seeing outside my window. But also just kind of more calls to be, okay, when can we, open the economy, right? And, this isn't fun. We actually have some data on how isolation isn't awesome, particularly if you have kids. People are feeling trapped. They're feeling like they have less space. There's more tension and conflict and, things like that. And just on a personal perspective, this is what a math lesson looks like in my house. We had to, work out some of the aggression that our children were feeling. And so they do arithmetic and punch pads. So they want to go out, they want to see their friends. The problem, of course, is that the virus also wants us to go out and see our friends. And that's the problem, right? Is the virus is still out there, and while we have contained it in Montana relatively well to date, it still lurks, and we have to deal with that. And when we talk about quote unquote reopening the economy, it's important to understand that there's not a single on-off switch. No person turned off the economy, and no person can ultimately turn it back on. And we see that in the data. Like this data shows restaurant closure or restaurant reservations on the OpenTable app, and it does it relative to the days before restaurants were ordered closed. And you can see that restaurants were largely empty, in some cases weeks before the state officially closed them. And on average, they had fallen by 73% by the day that they were officially closed. A different view of this, some researchers have gotten access to one of these scheduling apps that hourly firms use to schedule their hourly workers, and we can see the total number of hours that have been scheduled relative to pre-times. And there's a small gap between states that have imposed stay-at-home orders and not, or did it later. But even in states that have yet to impose any form of shelter-in-place or stay-at-home order, hourly workers, at least in this sample, their hours are down about 50%. So the economy has been largely turned off by our collective decisions and not government orders. And so it will take our collective decisions to reopen it again. And ultimately, that means that consumers need to be able and willing to consume, workers need to be able and willing to work, and owners have to be willing to even open. And that goes back to kind of what you learned in your very first economics class, if you took one, which is that firms operate when marginal benefits exceed the marginal cost. And that then depends on whether consumers are willing to consume and workers are willing to work. And those are governed by the risks that the virus actually poses and not by any government order telling us to stay home or not. And the reality is that people are still afraid of this virus. So here's a survey which asked about a bunch of different activities and how much risk people felt about it. And 91% of people view air or mass transit as risky. 89% view attending conferences as risky, 81% view attending family gatherings as risky, and 70% view going to the grocery store as risky, right? So that risk perception is still there. And even if you say, look, if Gallup posed this question, once government restrictions on social contact are lifted and businesses and schools start to reopen, how quickly do you think you'll return to your normal activities? And 80% say that you're either going to wait to see what happens or that they will continue to limit their activities indefinitely, right? So it's hard to operate an economy where only 20% of people say that they're willing to go out and do their regular activities. And what drives that, of course, is the fact that this virus is very bad. We still don't know officially how bad. The data are a little all over the place, but this chart here came out, when did I see this morning, actually. And it basically shows COVID deaths in the US and Italy relative to a typical flu season. And you can see that, it's much, much more deadly than the flu. And we think that the infection fatality rate, the number of people who die divided by the number of people who are actually infected, is somewhere between 0.5% to 1%, but we may be underestimating COVID deaths and we still don't have great data on prevalence. So that number will move around. Some real hard data that we do have from New York City, of course, which is a place with an extreme hotspot. But just amongst transit workers in New York City, they've had 78 people die of COVID officially. And given that there are 55,000 transit workers in New York City, if we do the math on that, that suggests on a per 100,000 FTE basis, which is how we usually measure occupation fatality rates, there are 851 deaths per 100,000 FTEs in the kind of roughly over the last 2 months amongst people who drive buses and subways in New York City. That's 8.5 times the jobs that we usually think of as dangerous, like logging or fishing. So that's a big change in the underlying risk of a lot of activities, and people's behaviors will reflect that underlying risk. And so in terms of trying to open up the economy, you've got to balance that risk with people's other desires. And the key question is from the business side of it, which is of course, I guess, who's going to actually put out an open sign and turn on the lights, is it worth it? And if consumers are isolating and continuing to isolate, they're continuing to be afraid, marginal revenue will be low. And even if there are some consumers, you have to expect that your marginal costs are going to increase. You're going to have PPP or maybe some sort of temperature screening or hazard pay, or you're going to face liability if your employees get sick while at the job. And there's going to be inefficiencies in your operations due to supply chain interruptions or labor disruptions. And so that's going to make it much harder for your firm to turn a profit. And if you're not a high margin business, then it may not be worth it to turn the lights on at all. And so the question that I don't know the answer to, but we'll hopefully find out as more places experiment with this and start opening up, is under what conditions can firm actually can reach a viable scale. And so, we'll start learning about that as places start to do it. But it's likely that there's going to be a lot of places that remain undersubscribed, right? So some researchers at MIT put out this graph recently, which they used cell phone data to figure out how many people are typically in the place, how close are they, how long are they spending that, and they created then a danger index based on, the number of people that are likely coming into close contact for prolonged periods of times. And then they did another different survey where they tried to figure out how important it was to people. And, stuff at the top, that's stuff that's important relative to its danger. And a lot of that stuff is still open. But as you move down, you kind of have, this is where we're going to face choices about what do we want to open, or what might be even viable to open, even if there's no government order, given that people will say, that's not a great place given how important it is to me, right? So that will kind of play out. This is kind of a crude attempt at trying to get at, well, what might viably reopen, or what should we reopen if we're going to do it by fiat, based on how much danger there is and how important do we think it is. Now, the important index is a little bit not perfect, but it was a useful enough thing that I threw it in here. So ultimately, the only path to economic activity deals with controlling the virus. And so there's two parts to that. One is we need to reduce the odds that people get or transmit the virus. And that can be via vaccine, or it can be via public health measures, right? Obviously, the vaccine, that's what we're hoping to get to, but that's likely many months, if not years away. The other way that we can get more economic activity is if getting the virus isn't as bad for me, right? We can reduce the harm. And that's part of the capacity argument on the healthcare side. Make sure that I can get treatment if necessary, and hopefully that treatment will help reduce the odds of me dying. But what we're really hoping for, at least in the shorter term, is that we get a new treatment that will dramatically lower the risk of bad outcomes. And there's hundreds of drugs that they are currently testing in some form or another. Hopefully some of those work out, but in terms of how soon we'll be able to know that it works and be able to manufacture it and distribute it in a way that ultimately will affect activity, it's still several months away at the earliest. So ultimately, the main thing that we have to try and control this are public health measures, right? So we have to reduce the odds that people get and transmit the virus. And, there's lots of different recipes out there. There's the AEI plan, there's the Harvard plan, there's the Paul Romer plan, there's the federal government's plan, there's each states have their own plan. There's a lot of different recipes, but they all tend to have the same basic ingredients, right? There's some level of physical distancing, there's some amount of testing, there's some amount of trying to track down all the contacts of anybody who tests positive. We need to isolate, ideally outside of the home, because we're seeing a lot of in-home transmission amongst those who are self-quarantining. And of course, then there's the capacity to treat those who need treatment, right? So, those are all the ingredients. The challenge, of course, is, so the vision is clear, there's different recipes, but which one we pick and how, it largely depends on how well do we think we can execute that vision. But the basic vision is we're all basically trying to make the same kind of cookie, but just like a bunch of different cookie recipes will yield a different actual cookie. We'll make our own choices about what mix of this we apply. The challenge, of course, is that, while we know what the vision is, whether or not we can execute it remains highly uncertain and, to be blunt, largely optimistic in the United States, right? We have seen that it can be done. South Korea, Taiwan, to lesser extent, Singapore, have succeeded in using public health measures to largely restrict the spread of the virus. But they have capacity that they have built in response to prior epidemics, and they have, acted sooner than us. And so they're definitely ahead of us in their ability to do this. But we'll start seeing, as more and more places in the United States try and lift some of their physical distancing requirements, whether the US recipes can work. So we'll be watching this closely. Hopefully it does, but there's a lot of issues related to testing supplies and our ability to actually effectively trace contacts and our ability to get people to quarantine, again, ideally outside of their homes. Those are all questions that remain to be answered in our own particular circumstances. So that's what it means to try and turn on the economy. Well, what's actually happening to the economy? And the easy sentence is that the economy is bad. This is something called the Weekly Economic Index that a couple of economists put together to try and help us understand what's happening real time in the economy, given the long lags we have in data, in the official data that will tell us what's actually happening. And it looks at various weekly and daily indicators that come out, and it tracks GDP relatively well. So if you look at the bottom one, that goes all the way back to the financial crisis, and you can see the financial crisis as the big dip, and you can see our kind of long, steady recovery and the kind of flat line that comes up. And then you get to the end and you see it fall off a cliff. And the top version is just the zoomed in version of us falling off the cliff so that you can see what's happening. But basically, the economy has fallen off a cliff. And where it is now, at least to our best estimates, or at least according to this estimate, is that the dip has fallen far, far below the dip that we observed in the Great Recession. And that's not surprising because basically everything is broken, right? So if you took an introductory economics class, you probably saw something that looked like this. It's kind of the flow diagram of the economy. It basically shows how money circulates around the economy. And basically there are red X's on every line except for those that come out of the government, because to some degree, every piece of the economy is currently broken. And as a result, we see big, giant declines. And now getting more specific, if some states, a handful of states, report unemployment claims by industry. And so using that data, some researchers put this together to kind of say, well, if we look at the unemployment claims by industry and then we allocate them based on the number of people that are working in these industries across the country, we can see what's been hit the hardest. And it's not surprising, accommodation and food services, we've got almost 30% of the people who used to work in that industry have filed for unemployment as of last week. And there's still errors in that data as well. And you can kind of go down the list. It's kind of utilities and finance and insurance have been the least likely to see unemployment claims. A slightly different approach that allows us to look just at low income jobs, which in this case is jobs that pay less than $40,000. And we can look at it by metro area or county, and we can see that by this estimate, 6,500 low-income jobs in Missoula County appear to have been lost. That by itself is roughly 10% of covered employment. So we think nationally and probably locally, whether it will show up as an officially unemployment because there's some technical issues there, but the quote-unquote unemployment rate currently is probably in the 15 to 20% range, which again is very bad. But that's not surprising, right? This was planned, right? I showed you this graph last time. We needed to hit the emergency stop on the economy to try and help protect the health. The question that we really want to focus on is how quickly can we recover from this? And that's a twofold question. Part one, of course, is the thing that we talked about in the first half, which is just how long will we be under some sort of partial economy because of fear of the virus? And then the other question is how quickly can we recover once fear of the virus has been contained, managed, or subsides? And that involves protecting our productive capacity and supporting demand. And so we have done that to some degree, but we need to do it a lot, right? So again, a different paper by a bunch of people at Harvard, they surveyed an existing network of small businesses and asked them questions like, how long can you survive? And given a different length of crisis, and this shows their answers based on how long the crisis lasts. And this doesn't include, the PPP program or other mitigation, but basically you can see that if the crisis were to last, say, 6 months, only 15% of restaurants and bars said that they could survive for 6 months. 45% of construction firms, small business construction firms. So the ability of our small businesses in particular, but our large businesses as well, to survive prolonged shutdowns without help is extremely limited. And so what we're trying to do on the capacity side is we want to make sure as much of this capacity that is viable long-term, we can, support it until it can survive. And that was what the PPP program was designed to do. And we had an initial release of data slightly before it all ran out of money. And thus far, at least Montana did pretty well. Like about 1/3 of our small employer businesses were able to obtain a PPP loan through the first week and a half of the PPP program. And that puts us, ranks us about 10th amongst all states. And so that's good, but again, that's only 1/3 of our businesses. And that doesn't include all the self-employed, the 90,000 non-employer businesses that I'm not counting in the denominator that only were eligible to get that money very late in the program before it ran out of money. Now, Congress says that they're going to give us a bunch more money, and so hopefully more businesses will be able to access it and be able to preserve that productive capacity. If you want to look at it by industry, some industries did a much better job of getting the share of payroll that they were eligible for covered. Mining, agriculture, which is actually on this chart, accommodation and food service, manufacturing, retail trade did pretty well. Other things did less well. Wholesale trade, management of companies and enterprises, finance and insurance. Hopefully, a lot of those places are not getting it because they don't need it. But to the extent that we're seeing some places like healthcare and social assistance, where we know that there's been significant layoffs, but only 1/3 of those business, 1/3 of the eligible payroll appears to have been awarded to that level of that industry. So there's definitely more work to be done in terms of supporting our small businesses. Thinking more broadly, in terms of, what does it mean for our productive capacity? As an economist, we'd like to talk about 4 forms of capital: physical capital, natural capital, human capital, and social capital. And so I've been trying to think about what might be breaking and what we need to start thinking about measuring might be breaking. In terms of physical capital, in some sense, it's getting a little bit of a break because a lot of it is going unused, but it may not be being maintained. Certainly some scheduled maintenance or investments in new capacity have been put on the shelf. And there's also some tax that's being done where we're rapidly shifting capacity to meet certain needs, which then will have to be shifted back once the crisis subsides. And so there's going to be some inefficiencies in physical capital. Natural capital is kind of enjoying a little bit of a break. There's less pollution, so that's good. But there's also been some less enforcement in terms of how we manage it. So that may be causing small amounts of damage, but I'm not currently that concerned about natural capital. What we're mostly concerned about are human and social capital. So human capital, obviously people are getting sick, they're dying. That's a loss of our human capital. We're having a generation of students who are having a significantly interrupted education. Both anecdotally and from data we're seeing, substantial proportions of students who are at the margin or at risk have not shown up for online learning. They may be suffering abuse, they may be suffering malnutrition. So there's going to be a lot of work to do to make up from the loss of human capital from our students. There's also just some loss of creativity and innovation, right? There's lots of conferences and meetings and random conversations that aren't happening that normal times create innovation that aren't currently happening. Now they're being offset because there is some crisis-induced innovation, and so hopefully there'll be some long-term returns to some of that. But a lot of that is just dedicated towards fighting the crisis. There's a variety of other issues, mental health, substance abuse, that may have long-term effects on our human capital. And then social capital, which is the thing that I'm actually most concerned about. At an individual level, it's kind of a mixed bag. We're kind of at home, maybe we're reaching out to our friends more with Zoom meetings or whatnot. But we're not kind of getting the same kind of social interaction. At a firm level, firm level social capital, a lot of that is client relationships or supplier relationships. And to the extent that firms in your network go out of business or are more likely to go out of business, that puts you at a risk of not being able to rely on those clients for revenue or those suppliers for inputs, which put your firm at risk. But the biggest questions that I have relate to community and national social capital, right? So this graph here is made by somebody who's actually writing a book on wildfire disasters, but she shared it because she thought it might apply to what may see with COVID, which is, right now we're kind of in the heroic honeymoon phase, but we're starting to tip into the disillusionment phase. And how we fight as a community and how we fight as a country to kind of keep our social solidarity, the level of social solidarity that is required to defeat a virus like an enemy like this, is going to require some work. And unfortunately, we hadn't put the work in the last several decades. We had seen erosion of institutions, erosion of trust in each other, that we're going to now have to overcome as we try and continue to fight this virus and, kind of hopefully maintain some sense of community solidarity going forward. So that's on the capacity side, but then the other thing we have to deal with is, will demand for our capacity exist? And obviously the first issue is, when people don't have income, there isn't demand. And right now, a lot of people are suffering pretty substantial income shocks. We are getting the unemployment payments that were in the CARES Act. They started flowing here in Montana last week, so the extra $600. Montana's unemployment system was already more generous than a lot of states, and so hopefully that will help cushion some of this blow. Hopefully the PPP program will help cushion some of this blow, but there's going to be lost income to a lot of people, and that will ripple through our economy. But the other thing that we have to kind of keep thinking about is, this is going to go on for longer than 35 days. It will last for probably several months, at least at some point, in some level. And that's long enough that we have to start wondering how much people's preferences will change, right? What might have been a viable business before may not be as viable now, because people are going to want different things. They're going to do different things. They're going to have learned things over the course of this isolation period, which may change their production function. The one that people talk the most about is, how much will people work at home? But there's a bunch of other ones. And so we need to be asking, well, how might preferences change, and how could that affect us here in Missoula? And that's going to be a hard question. There's lots of speculation at this point, but I'm not going to engage in that speculation, at least not yet. So just going back to where I ended last time, a lot of the three key actions that I laid out before are the same. We need to increase capacity to meet whatever needs we have currently. We need to preserve capacity while possible, and we need to facilitate the transition to normal when appropriate. The only things that I've added is that, obviously right now, specifically in the increased capacity, it's that the dance of trying to contain the virus so that our fear of contracting or spreading the virus can go down. That's where we're going to need a lot of capacity over the next several months. In the preservation of capacity, it's not just about identifying resources and facilitating access. We need to start moving into figuring out what's failing and breaking and why. Is there something we can do to save the thing that might be breaking? And if not, how can we contain the damage that it doesn't spill over and affect other industries or other parts of the economy? And the last thing is just the thing that I just mentioned before is, we need to start thinking hard about what's changing in terms of preferences and what that means for Missoula, and how we can make bets so that we can be better positioned to rebound quickly and put ourselves onto a path of longer, better prosperity over the long term. And with that, I have talked for right about 30 minutes, and I will stop and we can do questions.
Wonderful. Bryce, thank you so much for that lay of the landscape. We're going to open it up to Q&A, and just a quick reminder on process. We have our chat bar, and we're asking folks to use that, unless you're on the phone, to tee up your question. And if we could open it up first to our special guest, that would be wonderful. And we have about 10 minutes for questions. Is there somebody that would like to kick us off?
Sure, this is Ken Fickler. I'll ask one.
Thanks, Ken.
Thanks for your presentation, Bryce. That was all really, really great information, and really appreciate you digging into the data like that. One of the questions that I've been spending a lot of time on is what levers do we have to manipulate consumer confidence when we decide it's safe to reopen the economy, as you put it? Have you done any research into that, and do you think that that's a reasonable thing to shoot for, or is that something that's going to have to more naturally build up over time again?
So obviously the first question you have to address is you've got to make sure that people aren't afraid to go out. And there's two parts to the fear. There's the fear that I'm going to get sick, but for a lot of people, it's not just the fear of their own illness, it's the fear that they might transmit it to somebody who will be more severely affected. And so the first and the necessary hurdle that we have to get over is that fear of, so if I'm comfortable that if I go out, that we've done a pretty good job of containing the virus, and I'm very unlikely to get it, or I'm very unlikely to transmit it if I'm asymptomatic, that will be the first thing. And then the second thing is, of course, do I have money to go out and spend? And that's where, so those two things I think are the key ingredients. And so a lot of that will just be people waiting and seeing, and that's what the Gallup poll shows, is basically 70% of people are in I'll just wait and see, right? And I've seen lots of memes online about basically being people along those lines saying, yeah, you guys can all go out and we'll see if you all get sick, and if you don't get sick, then I'll start thinking about it. But there might be ways to, if we are confident in our data, right, and that's a big if, right, if we feel like we've got a good testing regimen in place and we're doing a good job with the tracing and quarantining, then, I think transmitting that to people and letting people know that, the reason that the virus is low here isn't just random and we're just waiting for somebody to show up and start spreading it around. It's that we are doing a good job of containing it. I think at the firm level, and we'll see again how this works out, some of the things like temperature screening or greater spacing or capacity limits, that might also help improve consumer confidence, at least in that particular business.
Wonderful. Thank you so much, Bryce, and great question, Ken. Is there someone else who'd like to ask a question?
Hi, this is Julie. I'll have a comment question. In terms of, I know, Bryce, you've talked about and stressed the fact that what the CARES package was truly a relief package. And now, based on what you're seeing, are you seeing any indication of further stimulus packages that would be helpful, or what that would look like just from an economic perspective?
Right now, the discussion is largely about just putting more money into the relief package. And, now we're starting to also we also need to give money to state and local government and a whole bunch of stuff. The challenge that we're ultimately going to get to is in this gap between hopefully being able to go back out of our houses in some form and where we've got the virus relatively contained, there's probably a lot of industries or businesses that are not going to be viable. And the question that we're going to have to ask ourselves is, what do we do for something that might need support for many months? And I haven't seen people grapple with that yet. Right now, it's like, oh, we'll give you PPP, and PPP runs through June. And I guess there's some other things that are longer term, but I think that to me is the big question. Is we need to start seeing what happens as economies do start to open things up, and we'll watch what happens in Germany. We'll watch what happens in Georgia. We'll watch what happens here, and hopefully we'll be tracking things very closely, and we'll try and start to figure out, well, what's a viable business in this environment. And then we've got to ask ourselves, okay, well, given what can survive, and then what else might be willing to provide as we try and bridge over the longer hall, but that's going to be hard because to the extent that this is something that might last a year or even longer, it's going to be an interesting public conversation to have about, how much support we will be willing to put into an economy to keep things alive that are not viable for that long.
Wonderful. Thank you, Bryce. We have about 2 to 4 more minutes, and I would love to invite people to ask questions, maybe even through the lens of your sector. Are there things coming up for you?
I've got a question, or more of just a new observation. So business owners that we work with are starting to get really frustrated that operations like Costco are open where they've been mandated to close, and are wondering, like, why can't I open and have 1 or 2 people in my small business at a time? And just this week I've started hearing people it's like their appetite is waning for this business closure, and they're starting to get, it seems, more desperate.
Yeah, that's fair. And given the marginal impact of closing non-essential businesses on both public health and the economy, I think you'll start to see some of that roll back. It will be rolled back in phases, but I expect that we'll start rolling it back, particularly as we get a little bit more data on what's happening in the states that haven't done it versus those that have. So I would expect that, to the extent that the government has closed things down, stuff that isn't large congregations, right? So obviously, if you're a concert or a sports venue or even a crowded restaurant, you might remain closed for a while longer. But yeah, if I'm a small business and I can limit the number of people to some level, I would expect that we'll move to that within weeks. So that should, I think, get resolved. The bigger issue is, can that business survive with only 1 or 2 people at a time? And that's what I'm going to be looking for.
Okay. Thank you.
Perfect. So we have time for one more call or one more question. And I see that Paul Gladen has a follow-up question based on an earlier question. I'm going to turn it over to him.
Thanks, Holly, and thanks, Bryce. Yeah, I'm sort of following up on Julie's question and your sort of response to that, which I think resonates with things we've been thinking about in the businesses we've been talking to about how they sort of reposition themselves and kind of figure out, can they survive through this? And one of your earlier slides talked about marginal income and kind of marginal cost. Is that really where we should be, to the extent we're working with businesses, helping them essentially just completely rebase their assumptions around what their income structure and what their cost structure is going to look like going forward? And a follow on to that is, as I've sort of thought about it in a way, there's sort of scarcity of supply. If we get some opening up that kind of restaurants may be less densely packed, would that lead to some level of sort of premium pricing in those locations? And is that viable, and is that a strategy for some businesses to try to navigate their way through this?
So the answer is yes to all of those. So yes, you should be hyper focused on just surviving at the margin, right? The goal is survival, right? If there are certain industries where this can be a windfall, where I could make a bunch of money and, turn a bunch of profit. But I think from many of the businesses, this is really just about, what can I do to keep myself from having to close permanently? And, that's usually where we say, okay, well, what's the marginal revenue? What's the marginal cost? And to the extent that you can raise prices and still attract customers, that should be on the table. There is nothing, your costs are going to go up in most businesses. If you try and open in-person business, there's going to be challenges to just, even if you're not, there's going to be challenges to operating in this environment if you're trying to do something that's not virtual. And those challenges are going to make it so that you're going to be less efficient and you're going to face higher marginal cost. At least that's what my instincts are telling me. And so to the extent that you can pass some of those costs on to customers and still actually attract customers, that certainly needs to be something that you should be experimenting with or considering.
Thank you, Bryce. Thank you, Paul. With that, we're going to transition to asking some questions or hearing from some of our task force members. But Bryce, we're so grateful. We know that you are in high demand right now, and we're glad that you joined us 35 days later.